I'm Dr. Dewey Bowie at TV Highway Chiropractic, and today I have Tong. He's our patient for today, and we've been working on Tong's lower back. But he said that he was working on his car, and then all of a sudden he started having the lower back pain. It became hip pain, and then started radiating down his leg. Eventually, Tong had lumbar surgery on his lower disc, and he felt good for a while, but the pain started coming back here. So he's here for treatment. What we're going to do is a conservative treatment where we're elongating his lower back, kind of opening up the space in between the vertebrae to help relieve some of that pressure that's on his nerves that's causing some of the lower pain that's radiating down his leg. So we're going to show you what that looks like today. And this table is going to help us distract his lower back and open up the space between each vertebrae. So we're going to strap you down, okay, and we'll stretch it out a little bit. Is that okay?
Yes.
Alright, let me know how you're feeling, okay? And we'll start our traction here. So before this, we did some therapy with ultrasound. We did some ultrasound therapy right around this area to help reduce any inflammation that's going on within the space between the vertebrae around the disc and the soft tissue. And now we're going to do his traction, which is slowly opening up the space between each vertebrae to help reduce the pressure on the nerves. Does that feel okay?
Oh, yeah, I can feel it while you're doing it.
You feeling the stretch?
Really, oh, yeah. But I kind of noticed that I don't feel the tingling, while you're doing it.
When it's stretching, you feel less tingling?
Yeah, less tingling.
So I'm applying pressure to L3, kind of the area above where his injuries are. And that's going to help stabilize the upper part of the vertebrae, and where we can do traction focus more in L4 and L5. Tong said he's feeling a little better today. Last week we did the same treatment, and he said he's had some relief. When it's really bad, what does it feel like?
Oh, you barely want to do anything. Barely can move, You gotta watch your step.
Can barely walk, right?
Exactly. Got that pinched up, kind of thing,
Is that okay?
Oh yeah. We can do this every day.
Here, that's been bugging him too, so we're going to adjust this area here right around T3 on the left side here. It's kind of jammed together and it's irritated the facets there, and it kind of flares up once in a while. So we'll adjust you here, okay, Tom?
Okay.
Alright, so we're just going to take a breath in here, and then we'll breathe. There you go. Good. Okay, let's have you tilt your head here a little bit too. Okay? Try to relax it, alright? Put your head right there. Okay, yep. Take another breath, and then breathe. Good. Okay. Good. Okay. Relax. Alright, now I'm going to lay you onto your back. Alright. Okay. So, we're going to cross your arms here over your chest like this. Scoot down a little bit. Okay. Nice and tight here. Now let's have you do a little sit-up. So I'm gonna lift your head up a little, okay? And then just lay all the way back. There you go. One more for you. There. Okay?
Oh yeah.
Yeah. Alright, just relax your arm here. So it's gonna traction your neck a little bit. This way. How are you feeling?
Let's do it again.
Do it again.
Feels so good.
Yeah. Or just relax.
Oh man. Yeah, big change every time you do that. Yeah, it helps tremendously.
Make sure you don't overdo it. No bending, remember?
Yeah, exactly.
Yeah. Right now you're not back.
Thanks, Dad.
Yeah.
Awesome.
My pleasure.